Dear students and my dear viewers, welcome back. In the previous session, we have discussed about the surface anatomy of the kidneys, both on the anterior side as well as the posterior side. Now, in this session, we are going to discuss about the relations of the kidneys. Okay. As we know that these kidneys are the retroperitoneal organs and which is almost located in front of the posterior abdominal wall. So, before understanding the relations of the kidneys, just we will brush up again the layers of the abdomen. Okay, so the layers of abdomen is broadly classified into 6 layers for easy understanding. From layer 1, that is anterior abdominal wall, to the layer 6, that is muscles of the posterior abdominal wall. So the layer 1 consists of the muscles which are present on the anterior abdominal wall. Here this pic is at different levels. So what are the muscles present on the anterior abdominal wall? One is the external oblique muscle. Next one is the internal oblique muscle and transverse abdominis, and at the middle you'll have the rectus abdominis muscle. This one is the rectus abdominis muscle, and this layer is the fascia transversalis. All these together forms the layer 1. Okay, in the layer 2 we can find the liver, liver, stomach and the greater omentum we can find. In the layer 3 we can find most of the small intestine, appendix, cecum and the colon. This forms the layer 3. In the layer 4 we can find duodenum with pancreas. Of course, these are arranged in different segments of the abdomen. I have already explained the segments in the previous video also. And then the 5th layer comes the kidneys with the large blood vessels. So this forms the 5th layer. That means the kidneys are located in the 5th layer. In the 6th layer we can find the posterior abdominal wall muscles as well as some of the important nerves and blood vessels, which are coming out through this vertebrae. So if you see all these things, so the kidneys are placed at the 5th layer. That means the structures which are present in layer 4, layer 3 and layer 2, all these structures are related anterior to the kidneys. So the structures which are belonging to layer 4, layer 3 and layer 2 are related to the kidneys on the anterior aspect, whereas the structures which are present on the posterior aspect, that is the 6th layer, what are all the structures which are present on the 6th layer, which includes muscles, blood vessels, nerves and also the ribs, and a diaphragm muscle, all are related to the kidneys on the posterior aspect. So this is the overall view. Now we are going to discuss what are the structures exactly related to which part of the kidney. Now in these relations also, first we are going to discuss about what are the common relations between the right kidney as well as the left kidney, and what are the structures related only to the posterior aspect, and what are the structures related on the anterior aspect, and what are the structures related over the hilum. So now first we will move on to the structures which are related to the kidneys, common to the two kidneys. Yes. So the common relations of the two kidneys are, So the upper pole of the each kidney, here we can find these are the upper pole of the each kidney, but here in this pictures, here also you can see in these pictures the kidneys are covered with diaphragm muscle, so we can't find the suprarenal glands, but at the upper pole both are related to the corresponding suprarenal glands. For example, on the right side kidney, so this is present on the posterior aspect, so it becomes the right kidney. So on the right kidney it will have the right suprarenal gland, and the left kidney it is having left suprarenal glands. Okay, here also you can find the same pic. Okay, and another thing is, so here you can see the iliac crest. Already we have found in the posterior aspect the iliac crest are related to the lower poles at a distance about 2.5 centimeters above the iliac crest. So for example, in this diagram we can draw the iliac crest here, and from the lower poles to the iliac crest it is the distance between the iliac crest and the kidneys are 2.5 centimeters. Okay, if you see the medial border of the each kidney, so this becomes the medial border of each kidney. Okay, at the each kidney here, so it is also related to the suprarenal gland above the hilus. So this becomes the hilus part. So above the hilus it is related to the suprarenal gland, and below it is related to the ureter. Below it is related to the ureter. So above the hilum it is related to the suprarenal gland on the medial aspect, and below the hilum it is related to the ureter. So here normally the ureter will come out from the hilum. So these are the common relations for both the kidneys. So the upper pole of the two kidneys are related to the corresponding suprarenal glands. Okay, and the lower pole is somewhat away from the iliac crest, that is in the above, that is 2.5 centimeters, and on the medial aspect, that is the medial border of the right kidney, above the hilum it is related to the suprarenal gland, and below the hilum it is related to the ureter. These are the common relations for the two kidneys. If you see the posterior relations, so this one also the common relations, but we can found only on the posterior aspect. So before understanding this posterior relations, so just we will brush up the structures which are found on the posterior aspect, that is posterior abdominal wall. In this pic you can find, so you can find this one is the diaphragm. So here in the diaphragm you'll have the medial arcuate ligament and lateral arcuate ligaments. Okay, and the lumbar flexus, the nerves are coming out. So the lumbar flexus, here you can see it is starting from T12 to L5, but the kidneys are located from T11 to L3, T11 to L3. So most of the nerves which are present in between T12 and L3 are related to the kidneys. Okay, and also some of the subcostal vessels and nerves are also related at this level, and the muscles which are located on the posterior aspect are related to the kidneys at this level only, from T11 to L3. So what are the muscles which are medial to the this vertebral column? The first medial muscle is the psoas major muscle. One is the psoas major, and next one is the quadratus lumborum. This one is quadratus lumborum, and this muscle is the transverse abdominis muscles. So all these structures which are found on the posterior aspect, and all those structures are the only structures related to the kidneys on the posterior aspect. So here you can clearly observe. So these are the structures. You can see the right kidney and the left kidney. So first we will observe the right kidney. The right kidney is somewhat located below the level of the left kidney. That means the left kidney is related to both 11th rib and 12th rib, whereas the right kidney is related only at the 12th rib only. It also touches some 11th intercostal space. That's it. So that is the relation with that of ribs. Right kidney is related to 12th rib, whereas the left kidney is related to both 11th rib and 12th ribs. And it is related to the diaphragm on the superior aspect. So, and also the medial arcuate ligament and lateral arcuate ligament. So what I have already explained in the posterior abdominal wall structures, the same structures now we can see here. And on the medial aspect, psoas major. Next one is the quadratus lumborum, and next one is the transverse abdominis muscle. These are the three muscles which are related to this thing. So the same thing is also the muscles are also related on the left side also. If you see the nerves and the vessels, so subcostal vessels and nerves, here also you can find the subcostal vessels and nerve. And what are the nerves which are coming from the lumbar flexus which are related to kidneys are iliohypogastric nerve. So it is a branch from T12 and L1, iliohypogastric nerve, and also other nerve which is also coming from these two branches is the ilioinguinal nerves. So these are the structures related to the kidneys, both common as well as posterior relations. Now we will move on to the common structures related at the hilum region. So at the hilum, I have already explained in the previous video. Again I am going to explain this thing, the common relations at the hilum region. So this is the anterior aspect. One is at the from anterior to posterior, So anterior you can find a renal vein, and next behind the renal vein you can find the renal artery. Okay, so here below this thing you can find the renal artery, and behind, that is most posterior, you can find the pelvis of the ureter. So these are the three structures related at the hilum region, whereas the branches of the renal artery is having 5 branches. Out of 5 branches, the 4 branches are present anterior to the renal pelvis, whereas the only one branch which is present posterior to the renal pelvis. So these are the common relations for the both the right kidney as well as the left kidney at the hilum region. Now we will move on to the anterior relations of the two kidneys. Here you will have some difference on the right side as well as the left side because of the organs arranged in the layers of the abdomen. So first we will see the right kidney. At the upper pole you can find the one area called as suprarenal area, where it is related to the right suprarenal gland, and next you'll have the hepatic area which is related to the liver. So this one is related to the liver, and at the hilum region, So that is the renal sinus region. You can find the duodenal area where it is related to the second part of duodenum. And at the fourth one, that is hepatic flexure of colon. So that means the colon, the ascending part of the colon, here where it comes to the upper part of the ascending colon, which is related to the kidney, that becomes the hepatic flexure of colon. That hepatic flexure continued as transverse colon. Okay, so this part of the colon is related to the colic area, and this one, this blue color, that is the jejunal area, which is related to the small intestine. Out of these, the hepatic and the intestinal surfaces are covered by peritoneum. Okay, so the lateral border of the kidney is related to the right lobe of the liver and to the hepatic flexure of the colon. So these are the relations on the right side kidney. When you move on to the left side kidney, on the anterior relationship, so you can find the suprarenal area here also. That one is left suprarenal gland is present, and you can find the gastric area. Okay, gastric area as well as the splenic area. The gastric area is related to the stomach, and so if you see this gastric area, the stomach is present in the second layer. So the second layer organ is also related to the fifth layer, which is present in the abdomen, because the location of the organs are at different heights. Okay, so for that reason, so the second layer structure, the stomach is also related to this kidney. This becomes the gastric area, and the splenic area. So the spleen is located and the pancreas is located on the fourth layer, which is also related to the kidney. The major part of the pancreas are related, and in the splenic area it is related to the spleen. Whereas in the case of colic area, so here the colic area is related to the splenic flexure and the descending colon. So here you can find the splenic flexure, which is continued as the descending colon. So these two structures are related to this colic area, and the jejunal area is related to the small intestine. So out of these structures, the gastric, splenic and the jejunal surfaces are covered by peritoneum. Okay, the lateral border of the left kidney is related to the spleen and the descending colon. Okay, these are all the relations of the kidney, both on the anterior aspects as well as the posterior aspects. In the next video, we are going to discuss about the capsules or coverings of the kidney. Thank you.